I'm Gary Atkins. I'm a consultant general and colorectal surgeon here at OSD Healthcare. The different types of hernias that you can get within the abdominal wall. If we start at the top, just below the rib cage there in the middle, you can get something called an epigastric hernia, which is often quite small. It can be quite uncomfortable, particularly on certain physical activities such as coughing and sneezing and heavy lifting, things of that nature. And again, typically would disappear when the patient is lying flat. A little bit further down towards the belly button, you can get something called a paraumbilical hernia. Now that's the name applied to hernias that typically show themselves in adults. If you have a hernia around your belly button from childhood, then we tend to call that a congenital or a true umbilical hernia. If you've had previous surgery to your abdomen and therefore have an incision somewhere on your abdomen, you can get a lump and or pain that occurs with that lump over the site of that incision, and we call that an incisional hernia if there's a hole in the underlying muscle associated with that. Probably the most common though is still the groin hernias, which is at the bottom of the abdominal cavity, and there's two types. The most common groin hernia is an inguinal hernia. There's a more uncommon hernia called a femoral hernia. And inguinal certainly is the most common in men. More women get femoral hernias, but they can also get inguinal hernias down in the groin as well. To repair a hernia typically involves surgery. Now to recover from that, it usually requires a general anaesthetic operation. Now we can typically do that as a day case. Sometimes if people are unwell and with other medical problems, then a local anaesthetic, so the patient is awake, is preferable. It will be sore in the area that's been operated on for a few weeks, but actually there's very few limitations put on patients after surgery. It's sensible to avoid very strenuous or heavy lifting, perhaps for 2 or 3 weeks. Driving is also probably best avoided for a week or so, just until the level of discomfort in the area that's been operated on is at a low level so that you can perform an emergency stop situation.